I'm going to just start talking because I never know. It says I'm streaming, but it's already spinning. So hello, everybody, and welcome here to the talk tonight with Dr. Tom O'Brien. I am going to make sure that I don't hear myself talking in the background there. Yeah, I see us on Facebook. Great. So, oh, whoops. Dump that under there so I don't hear it. So we're here to talk with Dr. Tom O'Brien about autoimmune and food. And this is on our Facebook page for practitioners. If you're not a practitioner, you can stay. We're not going to send you away, but we may get a little geeky and technical for you. But if you have an autoimmune disease, or if you have a loved one with an autoimmune disease, and you want to have some tricks and tips and some ideas on how to handle that, and what kind of foods are related, and what kind of foods trigger it, what kind of foods help to settle things down, calm the fires, so to speak, then hang out with us. Dr. Tom is, he's an amazing person. He has had this passion for healing people using food as medicine for 25 years or so. He teaches for IFM. He teaches at various schools. He teaches in wherever they can get him because he travels around the world and he's very popular and in demand. He's run his own summits. The gluten-free summit, you might remember, more recently was Betrayal, which was a video series where he interviewed doctors and patients about, and health coaches about autoimmunity and their kind of trials and tribulations in dealing with it and how they managed to get really good results with using food and nutrition. So thank you for being here. I'm so excited to have you.
Oh, thank you, Dr. Reed. It's always a pleasure to be with you. It's really fun, to have a comrade in arms, so to say.
Yes, absolutely. And Dr. Tom has been speaking at our Shine conference for the last 3 years or so. And it's great because he always likes to come back and do more. And he's talked about gluten, and he's talked about a lot of different aspects of gluten, the gut and all that. And this year we're going to have him on to talk this topic, really, the food relationship with autoimmunity. He's the author of the book, the Autoimmune Fix. And that came out not that many months ago, became a bestseller. And I was thrilled to see that he wrote a book because I'd been asking him for years, when are you going to write this in a book, right? He just use all this stuff and you're like, write this in a book, okay? So many people I know have picked it up and they just start reading it. It just makes logical sense to make sense of this. So
well, I think one of the important things when dealing with a health condition is to recognize there's different stages of a health condition. The first stage is you want symptom relief. And that's really important to get symptom relief. That's critically important and you can't play that down. And absolutely. Of course we don't, but I want to validate people. This is the analogy I give. Let me just warm up here a little bit. This is the analogy I give. When you've got symptoms that are bad enough that you need to go to a doctor to get some help, it's like you've fallen over a waterfall into the pond below and you swim up to the surface and spit out the water, and you're trying to stay afloat, but the water's really turbulent because the waterfall's still coming down into the water. And you're swimming in this turbulent water of diabetes, or this turbulent water of recurrent miscarriages, or the turbulent water of attention deficit for your son. Whatever the turbulent water is of your symptoms, you need a life jacket. And so everybody looks for a life jacket, and that's great. You need a life jacket. So get the safest life jacket you can, get the life jacket, but you don't stop there. You, of course, have to get out of the water. Then you go back up the hill, up beyond the waterfall, back up the river, back upstream to figure out what the heck fell in the river that caused you to go over the waterfall. Is it mercury toxicity? Is it food sensitivities? Is it emotional trauma? Is it structural trauma? What is it? And that's the world of functional medicine. And that's what you teach so well in your nutrition endocrinology courses, is this whole concept of going back upstream. So it's always a pleasure for me to come to your Shine conference, because you don't talk about, well, here's the best estrogen to use, and then your patients will be happy. You talk about, here's the best estrogen you might want to use, and why does the person need more estrogen? and you address that. So it's just a pleasure. And this year's topic is autoimmunity, which is my my baby that I've been working with. I did 28 8-hour-day presentations in 2009 talking about autoimmunity.
Wow.
28 different cities for 8 hours on this topic. And it's the average now, the British Medical Journal published this in 2015, I think it was, the average length of time from when translational research, when it's first published, meaning research that changes the way doctors think, translational research, the average amount of time before that research is in everyday practice is 17 years.
Wow.
That's the average. And that's in the British Medical Journal. So when they first started publishing about cholesterol may have something to do with heart disease, it was 17 years before the doctor down the street was testing cholesterol levels. 17 years. So some of the studies that we're going to be talking about, some of the concepts, they've been around for 10 years or 12 years. But it takes that long for it to trickle down to the average everyday healthcare practitioner, let alone the patients, right? But the healthcare practitioners, we like to think we're on the cutting edge because we go through our educations and but most of us are too busy to be reading the research papers. There's not enough time to read very much. You're just wanting to stay in practice and be successful and get the insurance to pay the bills, and help people get well. So it's hard to get on top of the cutting edge stuff. Well, that's what we do. That's what you and I do is we read the research and then put it together to show doctors and healthcare practitioners how to use it. That's why I like Shine Conference so much, is that the people that attend are just fired up to learn more and willing to be out in front of the 17-year average.
17 years, even in spite of getting a lot of flack for it.
Right.
When I have conversations with my MD friends and I talk about autoimmune disease as a reversible condition, they just say, you don't know what you're talking about.
Right.
Say, okay, well, tell my patients.
Cocky. They're cocky about it. They're
cocky. Right. And I say, look, you guys have the most amazing tools for acute illness. You guys have the most amazing interventions to, like you said, calm the symptoms down. And for healing trauma, you guys have it all. But when it comes to chronic conditions and when it comes to the imbalances that create the whole environment for these chronic conditions, you've got to let us handle it. Or open your eyes to the research that's in your literature, by the way.
Yes.
But you don't have time to read it, right?
Yeah,
so you have to risk that.
Well, here's the bottom line. You just have to look at the statistics. The World Health Organization for the last 5 years, every year, U.S. is ranked #1 in healthcare technology. Every year, we have the very best, the most sophisticated healthcare technology in the world. Every year. And every year, we're ranked at the bottom, in the bottom 5 of 57 industrialized countries for healthcare effectiveness. That's the bottom line. We're spending more than anybody else, and we've got the worst results of everybody.
Yeah.
That's the bottom line. So you can't stay in that. Of course, you want the best life jacket you can get your hands on. Of course you do, with the least amount of side effects. But that's not where you stop and rest taking your high blood pressure medication or your glucophage for your blood sugar problems or your steroids for your autoimmune diseases. You don't rest there. You feel comfortable and grateful that things have calmed down a little bit.
Right.
And then you investigate, where the heck did this come from?
Exactly. I love that whole analogy, that upstream, because that's what we do.
Right. Isn't it great? The day I thought of that one, I just said, thank you.
Yeah, you got it. You come up with the greatest. I love your little thing with gluten, with the little bopper thing, that little, like you drop it. You come up with great analogies. It really gets the visual going. But I want to make sure that everybody that's listening is aware. Like, let's just start with what's an autoimmune, what's the definition really? So we're all on the same page of an autoimmune condition. And you mentioned some of the root causes. What are some of those causes that are not being looked at in medicine?
Great. Antibodies are the big guns of our immune system. We have two separate immune systems. We've got the one that every animal has, every insect has, where when something gets in that shouldn't get in, we make these like bullets called cytokines. And their job is to destroy whatever got in there that shouldn't be there. Bad bacteria, molds, fungus,
Exactly.
viruses. You know, it's called the innate immune system. The innate immune system means it doesn't think, it just goes after it, boom, like this.
Right.
Humans and a few higher level species of mammals have a backup immune system that when the innate immune system can't get the job done, then so the pistols aren't working, firing chemical bullets well enough, you bring in the bazookas. Those are called antibodies. Mm-hmm. And that's called the adaptive immune system. When your immune system has to adapt, I say, all right, this isn't working. I need more help here. Let's adapt to this situation. Let's bring in the bazookas. The bazookas are called antibodies. When is it ever normal to make antibodies to your own tissue? Every day, it's normal. Mrs. Patient, you have an entire new body every 7 years. Yeah. Some cells reproduce very quickly, like the inside lining of your gut every 3 to 5 days. Some cells are really slow, like your bone cells, but you build new cells all the time. You have a whole new body every 7 years. How does that happen? Well, when cells get damaged, it's the adaptive immune system that makes the antibodies to get rid of the damaged muscle cells, like you exercise too hard, or the damaged brain cells, too much radiation from flying in airplanes, or the damaged skin cells, too much sun, that we make antibodies to get rid of those damaged cells. That's why if you do a test for antibody levels to your thyroid, there's a normal reference range. That's why it's normal to have some antibodies to your tissue. But when you have elevated antibodies to your tissue, you're killing off more cells than you're making. That's the autoimmune mechanism, is when your body is killing off more cells than it's making. When you kill off more cells than you're making for a long enough period of time, that tissue, if it's your thyroid or if it's your liver, whatever tissue it is, that tissue can't work quite completely anymore because you've killed off a bunch of cells. So that tissue starts becoming sluggish in how it works. If it's your myelin, which is the saran wrap covering your nerves, and you have elevated antibodies to myelin because it cross-reacts with dairy, and we'll talk about that, and you've got elevated antibodies to myelin, killing off myelin, well, what happens when you kill off enough myelin? Take the wire that goes from the battery of your car to the headlight. Go in the middle of that wire, take off some of the insulation, but don't cut the wire. Just take off some of the insulation. Now you've got an exposed wire, and the headlights are still working fine. But now take that exposed wire and touch the frame of the car. Now the headlights are flickering on and off. The juice isn't getting there. What's wrong with the headlights? There's nothing wrong with the headlights. It's the juice. It's not getting there. That's MS. That's what MS is, multiple sclerosis. And the mechanism of MS is elevated myelin basic protein antibodies as the primary antibody. There's a few, but that's the main one over a long, long time, killing off myelin, killing off myelin, killing off myelin. So whenever you have elevated antibodies to myelin, there's a normal reference range. But when you're elevated, you're killing off more cells than you're making. You're taking the insulation off a little bit at a time. And eventually, you're going to get little shorts in the electrical current. And that's when, you wake up in the morning, your foot's asleep, and it just doesn't kind of like come back as quickly as it should. And then, oh, good, it's fine now. But next month, maybe it's a little bit more. And next month, a little bit more. And then all of a sudden, you wake up one morning and you get out of bed and you fall. Yeah. And now you go to the doctor and they say, well, it looks like you might have MS, as if you just got it last night.
Right.
The autoimmune spectrum is when you have elevated antibodies when you feel fine, but you have elevated antibodies to your own tissue. You're on the spectrum. And if that continues, and the key is to find out, go back upstream to figure out why you have these elevated antibodies. But if that continues, killing off tissue, killing off tissue, killing off tissue, eventually the thyroid doesn't work right anymore, and you've got Hashimoto's thyroid disease. Or the liver doesn't work right anymore, and you've got hepatitis. Or your muscles don't work very well anymore. You've got sarcopenia. The names don't matter. The mechanism is the same for any tissue in your body. That's the autoimmune spectrum.
Right.
Now, our medical doctors, the tests that they do look to see, do you have elevated antibodies and is the organ not working very well anymore? Then they'll say, looks like you've got MS.
Yeah.
That it's an afterthought. Well, what this conference is about, what I'm going to talk about, is how do you go back in the spectrum to identify it at an early stage?
Yes.
Now, listen, Dr. Dale Bredesen, we know Dr. Dale Bredesen at Buck Institute at UCLA, and he runs the Buck Institute, the Alzheimer's Research Center. He's reversed Alzheimer's, completely reversed Alzheimer's. He published in 2014 in 9 out of 10 people. Now it's 3 years later, and he's got over 100 people. And now he's teaching practitioners all over the world how to do the Bredesen protocol. And all he's doing, not all, it's very complex, but it's functional medicine principles going back upstream to see what fell in the river, fix that, and fix that, and fix that, and fix that. And it takes these patients 5 years to reverse Alzheimer's because you build new cells every day. Some are very slow and some are faster, but they start feeling better within a couple of months, and 5 years later, the Alzheimer's is gone. It's in remission. That's true with rheumatoid. That's true with Hashimoto's. That's true with lupus. That's true with any autoimmune disease that you can arrest the development of autoimmune. Some are a little bit easier than others. Some of them are really tough, but it's just a question of educating the patient properly and the patient complying with the recommendations. Well, I'm not going to give up gluten. I like my cookies. We'll put that on your tombstone.
Right.
Right.
I always ask them, which do you like better, eating cookies or being able to walk to the bathroom instead of having to have someone give you a bedpan?
That's right.
Right. Which do you prefer? Right.
Well, I can have a little cookie once in a while.
Oh, right. No. Yeah. And we'll go into a lot more details on that mechanism. But what you're saying, though, it sounds like, with all autoimmune disease, getting to the root cause has a finite number of positive places and ways to approach it. But what's different from one to the other is really the Band-Aid care that's offered to help with the symptoms while you're working on the root cause. So for thyroid, maybe it's giving thyroid hormone. For lupus, maybe, there's something else, right? So we give different things. We make intrinsic factor antibodies. Maybe we're giving them, lots of B12 injections or things like that, depending on what it is, right?
Exactly right.
Stop there. The house burns down. I always look at it like if you have a smoke detector and the battery is in there and it goes blee, 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 blee in the middle of the night, it's annoying, right?
Right.
So we might be tempted to pull that battery out and we think that the problem's solved because now we can go back to sleep.
Right.
But the house burns down, and that happens with us in our bodies as well, right? Because you shut off the autoimmune process or the symptoms with steroids, and you give functional, whatever, thyroid tissue or whatever you're going to give, and now you think everything's solved.
Yep. That's exactly why you need the life jacket, but you don't rest in life jacket care.
Exactly.
You need the life jacket, great. Take the life jacket. Don't be stupid. Don't suffer unnecessarily. But you've got to go upstream to figure out why this happened.
Okay, so let's go back to food, and we'll go through a lot more of the mechanisms at Shine. For those of you who are registered for Shine, you're going to enjoy meeting Dr. O'Brien there. And for those of you who are not, if you go to shineliveconference.com, shineliveconference.com, you can read all about it and get yourself signed up. It's happening in November here in Austin. And if you've never met Dr. O'Brien in person, you're in for a treat because he's like a little teddy bear. He's just so warm and friendly and smart. So it's like
do you mean that I've got an extra 10 pounds on me or something like a teddy bear?
Not at all. A nice slender teddy bear, right?
Yes.
But he's got this microchip in the brain of the teddy bear that's like, it just keeps going. So let's talk food, right? Because we know that there's heavy metals and we know there's other stressors, but let's talk specific foods. You mentioned dairy and myelin sheaths. So let's talk about how food impacts the development and the reversal of autoimmune disease.
Sure. There are a number of mechanisms. The most common mechanism is called molecular mimicry. Mm-hmm. So when your body, if you take in a food that your body is sensitive to, we'll do wheat for this example. So when your body makes antibodies to attack the wheat that got in your bloodstream, the signature of the wheat, it's a series of amino acids. I'll say it's AABCD. The most common one is 33 amino acids long, but let's just say AABCD. So it's like it's wearing a flak vest, a flakjack vest or something. So your antibodies are going through the bloodstream looking for flakjack vest. Oh, look, over there, AABCD, boom, it fired their chemical bullet. Over there, boom, over there, boom. And your antibodies are going everywhere in the bloodstream to look for AABCD. Mm-hmm. I use the analogy that these antibodies are, just think of Arnold. Arnold's got his head out of a big Humvee. He's got the dark glasses on. You know, here in California, we call him the Governator. So just think of the Governator go over there and firing his chemical bullets, over there and firing his chemical bullets. Well, you know, as he's going through the bloodstream, looking everywhere for AABCD, over there, as the blood's going past the thyroid, in this example, the surface of the thyroid facing the bloodstream is made up of proteins and fats. Those proteins are made up of amino acids. The amino acid structure may include AABCD. And it's got more to it, but may include those bricks, AABCD. Arnold's got these dark glasses on, and he's not the sharpest knife in the drawer. Over there, and fires his chemical bullets at the surface of the thyroid. Now you have damaged a thyroid cell. Yep. Now, you've got antibodies to your thyroid to get rid of old and damaged cells, the normal reference range, but now you've got a few extra damaged cells because Arnold's firing his chemical bullets. That's not a problem. So you make a little bit more antibodies to get rid of the extra damaged cells. Not a problem. But you have toast for breakfast, a sandwich for lunch, pasta for dinner. Arnold. And if the weak link in your chain, if you pull at a chain, it always breaks at the weakest link. It's at one end, the middle, the other end, your heart, your brain, your thyroid, your liver, wherever your weak link is. If the weak link in your chain is your thyroid, then Arnold, because he's making, your body's making antibodies to wheat, and Arnold's everywhere. Arnold, over there. And he fires again at the weak link in your chain, your thyroid. Sandwich for lunch, pasta for dinner, croutons on your salad, bagel, a cookie, day after day after day after day, attacking the thyroid, if that's the weak link in your chain. And eventually, you're making so many antibodies to your thyroid to get rid of those damaged cells, this thing develops a life of its own and becomes self-perpetuating. Now you've got elevated antibodies to your thyroid being made all the time. Now you develop Hashimoto's thyroid disease. Mm-hmm. And the trigger that set it off may have been, in this example, a sensitivity to wheat. Yep. Many papers on this in the medical literature. Many papers. Reversing Hashimoto's thyroid, bringing the antibodies down to normal range, calming down that inflammatory cascade by putting people on a wheat-free diet. Many papers on that. Same thing is true with dairy. Same thing is true with spinach or corn or tomatoes. Certain tissues have the AABCD kind of structure similar to different foods. Yeah. We're going to talk about the foods, and we're going to talk about what tissues are you sensitive to. If you have a sensitivity to that food, what tissues are you vulnerable to having a cross-reactivity with?
Got it.
Or a molecular mimicry.
Important stuff to know for us as practitioners, so that we can just explain this in a way that our clients are going to get, that they're going to go, oh, wow. So every time I have that cheese that I absolutely adore, you mean I'm breaking down my myelin sheath a little bit more and a little bit more and a little bit more. And you go, yep, you got it.
Yep, if that's the weak link in your chain.
That's the weak link, right.
Not everyone with dairy sensitivity that develops myelin antibodies. You may develop beta cell antibodies, and that's
very common. Yeah.
That's why newborn infants that have a family risk of diabetes are recommended, do not give that child cow's milk in the first year of life. If there's a family history of type 1 diabetes, because the genetic vulnerability to developing diabetes may be in that child, and the structure of cow's milk looks very similar, A, B, C, D, to the beta cells of your pancreas, which makes insulin. Mm-hmm. So if you make antibodies to dairy as an infant, you get a little congestion, maybe a little bit of colic, maybe a little, maybe not. Bowel movements, smell. Babies' bowel movements are not supposed to smell.
That's right. I know. People don't get that.
Yeah. Human bowel movements are not supposed to smell unless they sit around for a while. But when they smell, it's putrefaction. Something's putrefying. Yep. And that's why it smells.
Rotting.
Right. But if the weak link in that baby's chain is the beta cells of the pancreas, family history of diabetes, you give that baby milk, they make antibodies to milk, baby seems all fine, everything's good, but you give milk every day, a couple times a day, and you make more antibodies to your pancreas, more antibodies to your pancreas, more antibodies to your pancreas. 6-8 years later, because this is self-perpetuating, now you've developed type 1 diabetes.
Right.
And that's true with so many different autoimmune diseases and the association with foods. That's what we're going to talk about.
Yeah, absolutely. Absolutely. This is great. So there's a lot of questions coming in. So are you okay with answering some of these questions? So again, if you want to get more in depth with this, we can go on for a long time. He's going to have a whole segment in there. It's shineliveconference.com. So Pamela wants to know, what are antimicrosomal antibodies? What test name does one ask for to track that?
Track antimicrosomal antibodies? I believe that's with the thyroid.
That's thyroid, yeah.
Yeah. It's just a thyroid antibody panel.
Mm-hmm. Yep. You can ask for an antithyroglobulin and a TPO and possibly a TPI. Great. So Sandy, hi Sandy, wants to know, I heard you say once that your system builds antibodies to wheat. You will always build antibodies to wheat. I have 2 questions. When you refer to wheat, do you mean wheat gluten only? If so, I was told to bake artisan sourdough bread using wild yeast and 100% whole wheat. And during the last rise, let it rise 7 to 8 hours.
They make this crap. I'm sorry.
Yes, thank you. The gluten will be eaten by the sugar. The long rise will, yeah.
Theoretically, there is some validity to that, but what percentage of the wheat peptides, the wheat proteins get digested? Nobody knows. And the way you know if you can do this or not, you do a comprehensive blood test. We'll talk about the testing. You find out, oh, look, my immune system says I've got a problem with wheat. You completely get it out of your diet for 6 months. You go back and do the blood test. Oh, look, I was successful. I wonder if I can have fermented sourdough whole wheat bread. So then you go eat fermented sourdough whole wheat bread for a month. You wait a month, and then you do the test again. If the antibodies come back, you can't eat it. You have to look to the system that's there to protect you. It doesn't matter how you feel. I'm going to give you an example, because people use how they feel to determine if something's good for you or not. No, that's not true. People say, well, I go to Europe and I can eat the wheat there and I don't have any problems. And if I eat the wheat here in the US, I have problems. Well, the problems that people get are GI problems, gut problems. That's what they're talking about. And when they go to Europe, they don't get any gut problems when they eat the wheat. The reason for that is that, in Italy, they've got 34 centers that are designated as gluten-related disorder centers by the government.
Oh, wow.
If you get your diagnosis from a gluten-related disorder center, your food's a tax deduction, your gluten-free food. And you can go to the pharmacies in Italy and order the food, and they've got fresh pasta for you the next day, gluten-free. Wow. You order it one day, you pick it up the next day. So they've got it down really well, right? So they look at this and they say, look, for every 1 person with gut symptoms, there are 8 that don't have gut symptoms. Gut symptoms are minor, but it's the only one that's obvious. You eat it, you feel sick. They say, oh, yeah, it's the food. But you eat it, and 3 hours later, you have a migraine. You don't think it's the food.
Yep, absolutely. Or exhaustion, right? You eat a meal and you go, oh, I just want to take a nap. Most
common symptom. Yep. So what they've identified is that for people that have gut symptoms when you eat wheat, for most of those people, it's the FODMAPs component of the wheat. It's not the gluten. And they say the gluten creates a lack of well-being. That means symptoms anywhere else in your body. And the whole list of symptoms that goes from fatigue to brain fog, to brain dysfunction, to social phobias, to joint pains, to muscle aches, that's the list that is lack of well-being. And the ratio is 8-1. So now why am I telling you all that? Because the wheat from Europe is much lower in FODMAPs. The wheat in the US is very high in FODMAPs. So when you go to Europe and you eat the wheat and it's low FODMAP, you don't get the GI symptoms, but you still get the immune response. You still get the elevated antibodies. And if the weak link in your chain is myelin basic protein, you kick up myelin basic protein antibodies again. Yeah. So that's why if you come back positive on the test, you cannot eat it ever, because you're just activating the production of the antibodies. And one exposure, it just takes one exposure, and you'll have antibodies to the weak link in your chain anywhere from 2 to 6 months.
Right. It's pretty amazing. I remember when I first heard you talk about this, it was probably 12 years ago, and you were saying how there was a study, and they basically saw that the equivalent of the crouton drops into the salad, and then they take it out. They don't actually eat it. They take it out. Right. That little bit of crumb actually triggers the antibodies. And that after 6 months, you see a significant drop in the antibodies. So thyroid antibodies.
Exactly. For those of you that are going, oh, come on, really? Really? Is it like that? Come on, really?
Right. This is a fad.
Here's how it works. When you get a vaccination for measles, they give you a shot of the bug measles. And your brain says, whoa, what's this? You general. And in your immune system, you've got Army, Air Force, Marine Corps generals sitting around with nothing to do. General, you now are General Measles. Take care of this. General Measles builds an assembly line. The assembly line produces soldiers. Those soldiers are called antibodies, and they're trained to go after measles. That's it. That's their job. They're assassins going after measles in your bloodstream. Over there, over there. Right? That's all they do. General Measles is watching all of this.
Yeah.
And when all of the measles bugs from the vaccination are gone, General Measles says, okay, turn off the assembly line. We don't need more soldiers right now. We don't need measles antibodies. You really shouldn't have measles antibodies in your bloodstream right now unless you've been exposed. But General Measles is vigilant the rest of his life. If you're ever exposed to measles again, he's always monitoring the bloodstream. He just has to flip the switch. He doesn't have to build the assembly line. And then within a day to 2 days, the antibodies are right back to fight the measles that you got from the person coughing on the plane next to you when you're coming back from somewhere. Yeah. That's why when you go to Africa, you need vaccinations months and months ahead of time for yellow fever and dengue fever and all these weird diseases. But if you go back to visit 15 years later, you need a booster shot 2 weeks before you go. Everybody's heard of booster shots. You just have to wake up general yellow fever or general dengue fever. Now, general measles is called a memory B cell. When you make antibodies to wheat, elevated antibodies to wheat, you've got a memory B cell. It never goes away. And when you ask immunologists, how much measles exposure does it take to activate the memory B cells? They'll tell you it's 1/1000th of the initial shot. That's how much wheat you need to be exposed to have a potential reaction, is 1/1000th of the initial dose that set you off.
Yeah.
That's it.
That's it. Those crumbs, right? Those little tiny crumbs. And I know personally that's happened to me. I remember getting exposed a few years ago where I had a salad, it was a tahini dressing on a salad, no big deal. And within, I don't know, an hour, I was feeling like this fog and I don't get tired. And I'm like, what the heck is this? What's going on?
Right.
I felt it in my tummy too. And so I went back to that restaurant a couple of days later and asked.
Here's an example. There was a paper that came out in 2014, I think it was, a child with celiac disease. And they did the endoscopy and full celiac disease, really sick child.
Yeah.
And they put the child wheat-free. And the child started feeling a little bit better, but didn't feel great. And the blood test kept saying, nope, still got elevated transglutaminase, got a problem here. And when they did an endoscopy, it wasn't healing. And he said, the doctor says, stop eating wheat. Doctor, there's no wheat in the family. There's none. And the nutritionist reviewed, there was no wheat, and they couldn't figure out. So smart doc sent them on a hunt. Obviously, the boy was getting an exposure somewhere. Where were the memory B cells being triggered? And you know where they found it?
Yeah.
His nighttime retainer. The retainer that he put in his mouth, it looks like plastic, and it's got little wire rims to hook on your teeth.
Yeah.
There was a little bit of wheat gluten in the plastic that they made. Yeah, that was it. And when they took the retainer out, within 3 months, the kid's antibodies went way down to normal. His microvilli healed, and he started to grow. That's the retainer.
That's how little it takes. And that's why we as practitioners need to be aware of this, because most people will come in and go, I've been on a gluten-free diet. I don't know why I still have Hashimoto's.
I'm fine.
I'm fine. It's not that. It's something else.
Really?
When you really dig, there's those little exposures. I remember you telling the story about the nun.
That's
who
right.
was taking communion once a week. And and for me, it was tahini dressing that had a little tamari. Now think about how little wheat. It's a salad dressing, a little bit of salad dressing on a big salad that has a little bit of tamari for flavoring, which has a little bit of wheat.
Yeah.
I was sick as a dog, and it took weeks for me to get back to normal.
Yeah. Yeah, that's it. That's it.
Yeah.
So for the practitioners, as you learn about this stuff, it's an OMG for you. For many people, it's an OMG. My presentations are usually a bit of an OMG.
Yeah, they are.
But it's just study after study after study. But you need this. You need this because we can't play halfway anymore.
Yeah.
You can't. I just saw Al Gore's An Inconvenient Sequel 2 nights ago. And, our planet, what we're doing to our planet and our people, what's happening to the humans is, the mammals, 78% of all mammalian wildlife around fresh water has been it's been eliminated between 1970 and 2012. In 42 years, 78% of all mammalian life around fresh water around the world is gone.
Oh.
It's gone. The cougars, the chipmunks, they're gone, 78%. And it's happening to us as humans. Our world's so toxic right now. You guys really need to counsel your people on take the life jacket when you need it, but let's see if we can reduce the need for the life jacket and get you vibrant and healthy.
Right. And the other thing that I hear a lot too is somebody will tell a story. We do case study calls in our practitioner training. We do them at Shine as well. And they come in and they say, okay, I'm working with this person, blah, blah, blah. And he went on this, ketogenic diet, gluten-free, dairy-free, blah, blah, blah. And he felt really good for about 3 months. But now he's starting to get his symptoms back.
Right.
So we go, okay, my first question is, what shifted? What changed?
Right.
Is he still following that same diet? Well, not as strictly. Is he gluten-free? Well, most of the time. And we want to find a solution for people so they can keep hitting themselves over the hammer and no longer get a headache. But the truth of the matter is, you're going to get a headache when you hit yourself over the head with a hammer. You're going to have a relapse in your gut symptoms and your autoimmune symptoms when you put back in the trigger foods, no matter how little it is and no matter how infrequent it is. Is that a fair statement?
You think that this doesn't relate to you, the audience listening to this right now, and doesn't relate to you and your kids? Then explain to me why is it the CDC says by 2026, 1 boy in 2 is going to be on the autism spectrum.
Oh.
1 boy in 2. You tell me if this is going to affect you directly or not in the next 10 years. And it's time to wake up.
Right.
That's what Al Gore is saying about the planet. It's almost beyond hope. And my only hope right now, because I have a young granddaughter and we're going to be having kids ourselves again in the future. And my only hope is what Einstein is. This is attributed to Einstein, that the problems we've created today cannot be solved with the same level of thinking that created the problem.
That's correct.
We need the next generation to up their game and think differently because we've screwed it up really bad.
Screwed it up.
And the only way they can up their game is if their brains work. And the only way their brains are going to work is if you wake up enough to be vigilant to create a safe environment for them.
Exactly.
So we all need to wake up.
Right. And food is the most critical piece of it. Why we do it every day, 2, 3, 4, 5 times a day, depending on what kind of diet regime the person's following. It's something we're repeatedly being exposed to. It's not like measles, somebody sneezes on you, somebody, influenza virus. You're exposed to this stuff every day. So if somebody is taking in foods that are increasing the antigenic load, foods that they cannot tolerate, that create a stress on the system, that cause their gut to become leaky, and we can talk more about that. I know your opinions about that. We need to help people with this. And it's not like we have, Dr. Tom has a magic food that cures autoimmune disease. No, he doesn't. He has a magic diet that
a magic pathway, a magic path.
Includes diet.
Walk this path and learn that what's on the end of your fork is the most common trigger to the dysfunction that you have, irrespective of how it's manifesting. The mechanism is the same across the board. Just depends on where the weak link in your chain is.
Absolutely. Absolutely. I was thinking about a presentation calling it Death by Fork.
Death by Fork. That's right.
Death by Fork.
Yeah.
We had a few more questions. Cynthia says, I have Hashimoto's connective tissue disorder. I'm highly sensitive to gluten and dairy. I'm currently on Nature-Throid bioidentical hormones and have just started chelation treatment, had amalgam fillings removed and got really sick. I've been on this journey a while. While I'm much better, there's still room for improvement. I still suffer from bouts of fatigue, burning eyes, and I seem to be losing muscle tone. Any suggestions?
Yeah, be kind to yourself. Be kind to your body. Stop being so aggressive, most likely, and make sure that your detoxification pathways are working well. So many people with that type of a symptom pattern have genetic vulnerabilities to not detoxing very well. Right. So if you were my patient, I would do the genetic test for detoxification. It's called a detoxigenomic panel from Genova. Mm-hmm. And it looks at phase 1, phase 2, and glutathione, a couple of basic things. Just basic things, and I'd see, look, I'm genetically vulnerable to not producing enough glutathione. So let's check my glutathione levels. Look, my glutathione levels are low. I need to focus on enhancing my glutathione levels because it's the master antioxidant that gets rid of all the crud that you're successfully trying to get rid of. Right. So it sounds like you have to be kinder to yourself, and many people who go on detox programs don't focus on their gut first. Right. You have to focus on your gut before you begin a detox program. Dr. Joe Pizzorno's new book.
Oh, yeah, it's great.
Toxic, what's the name? Toxic World or? I don't remember what it is.
I have it right here, but he just spoke to our practitioners. Where's his book? I had it right here. I was reading it. He just spoke to our practitioners on our NAPT program, and he was amazing. He just has done so much great research, but it's a toxin solution or something like that. Yeah,
the Toxic World or something like that.
Yeah.
But it's a fabulous book, but especially when people have diagnosed autoimmune diseases, and this person has 2 or 3, you really have to focus on preparing your body to detox before you start detoxing, or else you're going to get sick.
Right.
It sounds like you're getting sick.
And I always tell people it's reduce the toxic load is your first step. That you can do anytime.
Yes.
The more aggressive, let's remove and displace from tissue and put it in the bloodstream, and then you get really sick while you're trying to get it out, and then your gut is all clogged up and you're not getting it out. So, but reduce the toxic load is definitely step 1. And again, looking at those genes. You can, by the way, get that on 23andMe for those who want to do the 23andMe. You can get that. You just have to run it through a filter and look at those cytochrome P450 pathways. And you can find out, do you have to be more careful about pumping your own gas? Is that contributing factor, right? Because you don't get rid of heterocyclic amines or all different kinds of things like that. And when you do that, and the other thing is looking at Nature-Throid, I think is clean. But a lot of the thyroid medications, Armour in particular, I think they've cleaned it up over the last few years, has gluten in it. I had to get somebody off of there that she was eating stuff that had gluten and corn in her medication. So that's where the Band-Aid, the Life Jacket, is actually got weights in it and is pulling you down.
Well, that's very good points. And the way you'll know if you're successful at being gluten-free is you do the wheat Zoomer blood test and you see, do I have elevated antibodies? This is a new test that came out last year that's much more comprehensive than anything before it.
Oh, okay.
Much more sensitive. From Mayo Clinic published 99% sensitivity, 100% specificity for gluten-related disorders.
Fantastic.
At 26 different peptides of poorly digested wheat.
26, great.
26.
Great.
Plus, it looks at intestinal permeability, the antibodies to zonulin and actomycin. Plus, it looks at zonulin levels. All of it in one test.
So it's called the Wheat Zoomer. Is it available to the public, or does it have to be set up by a practitioner?
I always recommend a person go to their doctor and ask for this test. You can get information on my website, thedr.com. But if your doctor won't do it, you can order it on my site. But I prefer you go to your doctor so your doctor learns about it.
Right. Well, that's good too. But our practitioners in our program, we have access to, so I'll look into getting that. They get access to their tests through me.
Great.
They don't have a license, but some of them are MDs or nurse practitioners or whatnot. They can.
I'm making a note. I'll make an introduction to you.
Yeah, please do.
Dr. Vida.
Please do. Yeah. Yeah. So that's great.
Good.
Yeah. So who else? John says so frustrated with nursing school because they don't teach anything other than more drugs, chemo, and radiation. I hear you.
Yeah, you're right, man. Just hang in there, get the degree, get out, and then learn about all this. Or keep learning while you can, but get the degree, learn everything you need to about the acute stuff so that you're competent at this. And then you'll walk people through why the life jackets are good. But then let's see if we can help you reduce your need for the life jacket.
Yeah. And I would recommend you come to Shine because you're going to run into, we have a lot of nurses in our program who go through the conventional training, do the practice for a while, and then they say, okay, I want to really know how to get to the root cause.
Yes.
So again, it's shineliveconference.com, and you'll get to hang out with us there. Mary, is it true with cancer too to reverse in reference to body replacing its cells?
Say that again.
She says, is it true with cancer too to reverse in reference to what you said about the body replacing its cells?
Oh, yeah. Every cell in your body regenerates, every cell. Now, cancer cells, of course, are regenerating too quickly. They're rebuilding, they're multiplying, and so you have to stop that mechanism. I'm no cancer expert, but we've seen some really nice results when people who are going through the life jackets or decide not to do the life jacket when they apply these principles. Lots of doctors who specialize in functional medicine for cancer patients. There's a number of them around the country.
Yeah, absolutely. And it's all similar. And Mary also asks, why is there no talk about Graves or hyperthyroid? There's more on hypo, and it's hard to find info on hyper.
There's no difference.
That's what I was going to say too. Thank you.
Oh, sorry.
Yeah, no, I'm glad you said that because that's what I was going to say. An autoimmune disease is an autoimmune disease is an autoimmune disease. And the approach is the same, whether it's Graves, Hashimoto's, lupus, intrinsic factor antibodies, type 1 diabetes, and even Alzheimer's in some.
There are 5 different autoimmune thyroid diseases that I know of, and all of them have different symptoms. Graves' symptoms are very different usually than Hashimoto's, so that's very true. But this big picture overview about going back upstream to figure out what fell in the river is the same for all of them. That's what you have to get. You have to understand that while you're doing the life jacket to keep you functioning, great. Hopefully it's a good life jacket with not too many side effects. But at the same time, you're looking upstream to figure out where the heck did this come from. And the rule of thumb in my practice has always been, you'll know you're in the right place within 3 weeks. You apply these principles within 3 weeks, you're feeling better. Nothing's fixed completely, but you notice that you're sleeping a little better, or your energy's up, or wait, I've only had 2 bad days this week instead of 6. Or you'll just notice that you're on the path. Right. And if you don't notice that in 3 weeks, in my opinion, we miss something.
Right.
And then we go back to what David Jones, the president emeritus of IFM, used to tell this story all the time to every class. He'd tell the story. And that is when he'd go into a room to see a patient and she'd say, I'm no better. He'd look at the file, look at the patient, say, would you please excuse me a moment? Closes the file, stands up, walks out of the room, closes the door. Takes a deep breath, walks back in, sits down and says, hello, I'm Dr. Smith. Dr. Jones asked me to come in to see what the problem might be because he doesn't have a clue. Let's start at the beginning. And he goes right back to the beginning because he missed something. Yeah. If they're not better, you miss something.
Yeah.
And so you got to go back to figure it out.
Back to figure out what that is. Got it. Got it. Mary wants to know what we think of a new supplement called Autoimmune X. You familiar with it?
Oh, that's a good marketing term.
Okay. Have you heard of it? No, I haven't heard of it either. It's about, you have to evaluate supplements based on what they contain. You have to look at the efficacy of the ingredients, but you also have to look at the quality. Now, you don't want to be taking a supplement that's introducing talc and gluten and all kinds of other stuff.
Realistically, people aren't going to do that. They're not trained. They're not educated to do that very often, you know. You have to find a healthcare practitioner you trust.
Yeah.
And then you ask them, why are you recommending these supplements to me? What is it about this one as opposed to Autoimmune X? Why do you recommend this? For example, in my practice, I've got these, I call them GS packs, gluten sensitivity packs. There's 22 nutrients in this one pack. It's 6 pills, but 22 nutrients. They all turn on genes to reduce inflammation and heal intestinal permeability. So I just tell patients, I made sure these are great. These are high quality. They get the job done. In your practice, you may have chosen another line of products. There's so many products that will heal the gut. There are so many that heal permeability. So it's not that mine is better than somebody else's, but when you've got someone like Dr. Rita or me or your practitioner who you have faith in, and you ask the question, why did you choose this company's products as opposed to another? And then if you feel comfortable with their answer, you say, okay, I'll give this a try for a couple of months and see. And if it doesn't work, it's not the concept of the nutrients. It may be the nutrients themselves that don't work for you. You need another form of that nutrient.
Right, exactly.
And so all those questions about the quality, the ingredients, the fillers, that's the job of the doctor.
Right, and these are practitioners. So
right.
We're talking to the practitioners here. So they're going to ask more sophisticated questions about.
Got it.
And that's how I would say, if you're looking to identify what's a good product for your clients, then you want to be looking at that and do your due diligence on the efficacy of the ingredients.
And you guys don't know the answers to those questions. I know you don't, because you haven't studied nutritional biochemistry, most of us. And so you don't know. So what do? Well, when you go to symposiums, you ask the vendors. What is it about your company that makes it unique? What about these filler products? You ask people, or you can be comfortable that at places like IFM or at Shine Conference, there's not going to be any schlock vendors there. Dr. Rita won't allow it. IFM doesn't allow it. So you will, you know from the beginning that the vendors at these kinds of events are going to be higher quality.
Right.
Ask them the point blank questions. And some people feel awkward about asking the point blank questions. It's your job.
It's what we need to do. Yeah. And everybody comes out with these products and they market it as the solution to the disease.
Right.
And it's a life jacket. It's a Band-Aid. It's supporting, it may be actually addressing some of the underlying cause, which would be nutrient imbalances.
Right.
But I always ask, nutrient imbalances aren't necessarily the root cause unless the person's on a starvation diet, not getting them in there. Right. Why are they not getting those nutrients in? Is it a digestive issue? Exactly. Is it an absorption issue? Right? Is it a psychological stress issue?
Did their mother have antibiotics during her pregnancy with the baby?
Exactly. Right? Those are the
have to figure out where it's coming from. Yes.
Absolutely. A couple more. Jennifer wants to know, why would autism increase so much?
Every child that's checked in America today, in the studies that I've seen, every single child has on average 186 toxic chemicals in their bloodstream at birth. Many of these chemicals are neurotoxins. What more is there to say? In Norway, they've done many studies, and the government really debated about this, decided not to, but they came really close to recommending pregnant women, when they're tested, need to be tested for PCB levels.
Wow.
If their PCB levels are high, they cannot breastfeed the first baby for the first 3 months. You mechanically extract and throw it away.
Wow.
Because these PCBs are estrogenic endocrine disrupting chemicals. They sit in estrogen loving cells. Where is there a high concentration of estrogen loving cells? In the breast. Mm-hmm. What happens when a woman is in delivery? The mammary cells get turned on to start making milk. Where does the milk come from? The mammary cells. What's also in the mammary cells? PCBs. So if a woman is high in PCBs, they're highly concentrated in the mammary cells, so that milk is coming through highly concentrated in neurotoxins.
Yeah. Yep, there you go. Toxic environment. Stephanie wants to know, Candida overgrowth, but also been tested to have high levels of nickel. Is it true that Candida surrounds the bits of heavy metal to protect brain cells? And what foods can I eat to detox the heavy metals before attempting to get rid of the Candida?
I don't know about protecting brain cells, Candida to protect brain cells, but nickel toxicity has been shown to be a side effect of gluten sensitivity.
Okay, there you go.
Volta, Umberto Volta in Italy, who's the chair of the Celiac Society, that published on that a number of, when I interviewed him for the Gluten Summit, he talked about this. I said, really? Yeah. Nickel? Really? And yes. I said, oh, that's really interesting. And yes, Candida has a love of nickel. I don't know why, but it does.
Okay, so we're getting back to the food again. Okay, so John says Tom O'Brien's Betrayal series stated that virtually everyone has a negative reaction to ingesting gluten and similar compounds found in wheat. Even those who don't believe they are sensitive show signs of leaky gut and autoimmune reactions, but they manage to recover in a few hours. Please provide references to published research showing the details of this phenomenon.
Oh, I love this. Give me the studies, or are you full of it? It's great, John. Great question. It's Holland, Hollon, and his team at Harvard.
Holland and at Harvard. Okay, great.
Every patient, when they're exposed to wheat, develops intestinal permeability. Every single human.
Yeah.
Now, it heals quickly, but when you cross the threshold, it doesn't heal anymore.
Mm-hmm. That's right. There you go. And you know, it's interesting. You probably have some of these references in your book, right? I mean,
yeah. Oh, they're all in the book.
They're all in the book. So get his book. Those are. All right. So Linda, what's the best way to find the trigger foods? It's a good question.
Go for the most common ones first.
Yeah.
So that's wheat, dairy. They're the most common. And there's no test out there now like the wheat Zoomer. This is going to change the face of laboratory medicine. This is just remarkable. It's really remarkable. I'm so glad to have this tool. So that's the first thing. Also, you look at the patient. Do they have signs of edema? Do they have allergic shiners? You know, the darkness under the eyes, and sometimes there's shiners all the way around the eyes.
Yeah.
Do they have histamine reactions? You just take your hand and just stroke across the abdomen. I'm doing it higher so you can see it, but stroke across the abdomen, not to tear the skin, but just with your nails a little bit, 1, 2, 3, and wait 30 seconds. Do you see red streaks? That means they've got extra histamine in their body, excess histamine. Where's it coming from? Well, the most common source is food, so it can be others, but that's most common. Do they have sock marks? You know, when you take your socks off, Mrs. Patient, can you see the elastic band around your leg and the socks weren't really tight? Or underwear marks? That's edema, and that's most commonly from food sensitivities. The liver blemish is another really good one. In between the shoulder blades, you press on the skin between the shoulder blades. And when you take your finger away, you look at the blemish there. How long does it take to get revascularized? 1 second, 3, 1. It should be a second, maybe 2 seconds.
Got it.
And why? And you'll see people that have congested livers, which is often from recurrent food sensitivities. It takes 4 seconds, 6, 8 seconds.
Wow.
And why? Because your liver's an oil filter. Your oil filter is dirty. So where does the blood go when it goes through the liver? It goes right past the area of your back and between your shoulder blades to go out into circulation. So if it's sluggish coming out of the liver, you're going to get liver blemishes. That means you got a dirty oil filter.
Cool.
Yeah.
Good stuff. Good stuff. I think we have 2 more questions. Emma says, losing weight due to radiation enteritis diagnosis. I started using GI Revive, and it seems to calm things down, but no weight gain. Any recommendations for someone with damage to GI from prior radiation therapy?
Oh, absolutely. I would be doing colostrum twice a day. And the colostrum that I like a lot comes from Andrew Keach. Dr. Keach is just the very best. Great story about him. But all of his colostrum is grass-fed cows, no antibiotics, no growth hormones. Every batch is tested, every single batch, for 43 different potential contaminants. And every batch is tested when it comes in. And it's a miracle. In nature, how do you turn on the genes to heal a permeable gut? Every newborn infant's highly permeable. They're permeable in utero. And it's colostrum, first 3 days of brother's breast milk, that turns on the genes. Okay, let's tighten up those junctions now, and let's start building some receptor sites, because food's going to start coming down pretty soon. It's colostrum that does all that.
Yeah, good job. Good stuff.
Oh, one more thing for that person with enterocolitis, and that is you have to rebuild the microbiome. You absolutely wipe out the microbiome. So
Absolutely.
Pay attention on that.
Yeah, and the other thing is, I think that it's motility as well. So the motility of the tract gets thwarted by the radiation as well.
Yeah, lots of oxidative damage, and as you wipe out the microbiome, the enteric nervous system is impacted dramatically, and so you can get sluggish.
So vagus nerve stimulation is probably a good idea, and de-stressing, getting into parasympathetic more. New diagnosis of, this is Barbara, new diagnosis of morphia, EEK. Where did this come from after 60 years of living? Suggestions to work with dermatologists. This must go deeper. Right, dermatologist is typically, here's some steroids and have fun.
Yeah, same mechanism. What's going on? Where did it come from?
Yeah, looking back to see. So we're always going back, and we're looking at what are the factors, what are the stressors, what are the food stressors, what are the environmental stressors, what are the emotional stressors, what specific things that, like in Emma's case, there was a radiation, right? There was a radiation exposure. So that can be triggered to be a root cause.
For a patient with dermatological conditions, first thing I would think of is mold and fungal infections.
Mold and fungal, okay. Good job. Last question on our list is from Bo. Mom did take antibiotics in pregnancy. What do I expect? So give us kind of the sequela of mom taking antibiotics in pregnancy.
Oh, she wipes out, the antibiotics wipe out quite a bit of the normal flora that should be. The average is 30% of the diversity is dropped in 2 days.
Wow.
Antibiotics, 30% reduction in diversity. And so depending on when she took the antibiotics, what stage of development you were in at that time, what cells are developing will be impacted by the microbiome in mom.
Yeah.
And so when baby's born, she may be born with a compromised, the microbiome is passed on through the mother.
Yep.
So if mom was still compromised at birth, then baby was born compromised, and then the whole inflammatory cascade can begin. It depends on how bad it was and how it manifests. I just saw a person yesterday who has the most severe adult eczema I've ever seen.
Oh, wow.
And she's had it her entire life, and they put her on steroids when she was 3 years old, and she's still on steroids now at 28. And she's failure to thrive and really a mess. Well, it turns out that her mom had severe emotional trauma during the pregnancy and then was put on antibiotics.
Wow.
The impact can be lifelong. The key is to identify what's the mechanism that's going on, what are the biomarkers that we can look at, the whole function medicine principle that you teach in your courses. Mm-hmm. That's the key.
Right. It's always to go back to the why, the real why. So, okay, you've got this, why? Okay, it's because of this, why, until you can get to that final definitive, okay, this is the why.
Rita, I don't know that I've ever said this before to you, but my first healthcare mentor was Dr. George Goodhart, founder of Applied Kinesiology, the muscle testing that people do. And I was going to be an associate in his office when I graduated. And I said, well, Dr. Goodhart, thank you, sir, but excuse me, but you don't pay enough. And I've got an 8-month-old little girl now, but I'm going to be on your footsteps forever. I'm going to follow you forever. And I did. I have 450 hours with George. But every weekend in his weekend workshops, his Sunday mornings were always the same. Always. He'd start off with a prayer. And it was a 30-second prayer, just something simple but humble and just lovely. And he's saying, we ask this in thy name, amen. And if anyone doesn't like this, it's too bad. It's my football. And then he'd go into philosophy for about a half hour to an hour. Whatever the topic was of the weekend workshop, it just stopped. George is on stage. And the pearls were just unbelievable. That every single time there were more pearls. And the one message that was so consistent in those Sunday morning sermons, the one message was, and he would stomp his foot in the ground. He'd get this position. I could see when he was getting ready. And he'd go, why, doctor? And he'd slam his foot on the ground as his fist came through saying, why? Boom, on stage to really drive it into us. Why is this happening to that patient? Your job is to find out why.
Exactly.
He just drilled it in again and again and again.
Yeah.
Never stopped.
You know, I came through a computer science background. So math, computers, you always had to keep digging. You had to dig.
Yes.
And the same thing applies with the body.
Yes.
Just a different hardware and software.
Yes.
So I want to just let everybody know, if you really like what you've been hearing tonight, you're going to get a whole lot more of Tom and I for the weekend, 3 days at Shine in November 3rd through 5th in Austin, Texas. And it's shineliveconference.com. And head on over there and get your ticket before we sell out. We had a couple people asked a question here on this chat. Let me see if
I'm going to need to go soon.
You have to go. Okay, good. So whatever questions we still have, we're going to answer at Shine. So come to Shine, shineliveconference.com. And is there any parting words you want to share with folks?
Yeah, both for Dr. Rita and this conference. I've had the privilege of being on stage there for the last 3 years. This will be the 4th time, and I look forward to it every year because the people are so great. They're open and receptive, and it's people that really want to know. If you really want to know, and you can be on the fence, and you should ask. I think everyone should be skeptics to new information.
Yes.
I'd be in your face if you're a cynic. If you're a cynic, you don't belong there. If you're a skeptic, great. Ask the questions. Ask the questions and keep asking until you get the answers that make sense to you.
Right.
And Dr. Rita's all about that. I'm all about that. This is one of those conferences where it's lots of intimate conversation. So I would second her invitation to you to come hear us do our thing. Guess I'd say it like that.
Prophesize. And I love what you said about being a skeptic, because I always tell people, don't just believe anything anybody tells you at face value, including me.
Yeah.
Find out, bounce it off yourself. Is it going to work for you? Does it make sense in the science? And then go for it. And we'll be sharing a lot of that. It'll be 3 days of in-depth work to really have you mastering using the power of food to heal. It's an amazing thing, food and nutrients. And, attitude plays in there a little bit as well. So we're going to have fun, and we're going to share lots of stuff, and you're going to walk away a different person and with different ideas and how to actually implement this in your practice. So thank you so much. I know you're busy, and I'm so honored that you're taking time out, not only to be here tonight, but to come and spend time with us at Shine.
Thank you. It's a real pleasure, and I look forward to it. I truly do.
Look forward to it. Bye now.
Bye.
Stop the live stream.